How's it going, guys? Past level question, hematology, step 1, internal, family, 2CK, 34-year-old woman. No vignette on purpose because I want you to know the lab values here. You'll have them available to you in the exam, but it's a waste of time if you're looking them up. You got to know these basic ones. Hemoglobin normal 13 should be 12 to 17.5. Menstruating women 13 to 17.5. Non-menstruating women and men. Leukocytes normal 5,000 should be 4 to 11,000. Platelets slightly low 145,000 should be 150 to 450,000. Bleeding time elevated 8 minutes should be 2 to 7 minutes. Prothrombin time normal 14 should be 10 to 15 seconds. Partial thermoplastin time normal 37 seconds should be 25 to 40 seconds. Creatinine 1.2 normal should be 0.7 to 1.2. Blood urea nitrogen normal 19 should be under 20. What's most likely diagnosis? Choice A, plastic anemia. Wrong fucking answer. So this is when you have all three cell lines decreased. Red blood cells, white blood cells, platelets. 9 out of 10 times when all three of these cell lines are low, it's aplastic anemia in USMLE. Just means the bone marrow is not producing. Clearly, we have normal hemoglobin, we have normal leukocytes. So even if you have no idea what's going on, you know it can't be aplastic anemia. Viral infection, highest yield cause in USMLE, parvovirus B19. Okay, so they don't have to specifically make the vignette about parvo. It could just be patient who's had a recent viral infection. Then as all three cell lines decrease, you just assume that it's parvo. Increased risk in sickle cell, but of course need not be the case. It can be things like chemo, radiotherapy-induced pancytopenia. It can be even lupus rarely, where you have antibodies against hematologic cell lines. It can be weird things, congenital anemias like Fanconi anemia, autosomal recessive. So that's when you get aplastic anemia plus absent or hypoplastic thumbs and radii. Wrong fucking answer. Choice B, diamond black fan anemia. Wrong fucking answer. So very obscure condition. I've harped on that when students don't know an answer, they choose weird sounding shit. Maybe shows up once in history. This is just a pure RBC aplasia, meaning that your RBCs only are decreased, and it can present in children with triphalangeal thumbs. Wrong fucking answer. Choice C, ITP, correct answer. So we have decreased platelets, we have increased bleeding time. That's it. Okay, so classically you'll get you'll get two vignettes for ITP. USMLE, you're gonna get a school-age kid who's got epistaxis, petechiae, bruising. Can be classically after a viral infection, but they need not mention the viral infection, about half vignettes. It can be a woman 30s to 40s with random bruising. Family medicine forms where the platelets are low, bleeding time is up, and that's ITP. If they're normal, that's domestic abuse. So very bread and butter for USMLE. You got to know that if you see low platelets and high bleeding time, that's just classically ITP, especially if you get skin findings now or epistaxis. Now here, we didn't give you any vignette, but it doesn't matter because we can easily eliminate to get there. So mechanism is going to be type 2 hypersensitivity. So immune system forms antibodies against glycoproteins 2B, 3A on platelets, platelet aggregation, and you're going to treat with steroids, then IVIG, then splenectomy. So let's just whip through the final ones here. Normal findings, wrong fucking answer. Obviously, through this in here, be a malignant asshole because students glance at these labs and they say they're not sure and maybe they're normal. Wrong fucking answer. Choice E, TTP, wrong fucking answer. So this is going to be a pentat on USMLE. This is a microangiopathic hemolytic anemia where you get renal issues. Number 1 can be creatinine, BUN elevation or hematuria. Number 2, thrombocytopenia. Number 3, schistocytosis with hemolysis, where your hemoglobin is going to be low. Those 3 are what you see also with HUS, hemolytic uremic syndrome. Okay, but you're going to add for TTP, you get the pentat, you add fever, neurologic signs on top of it. Okay, so TTP is idiopathic, all right, where you get antibodies against ADAM, TS13, matrix metalloproteinase, failure to cleave von Willebrand factor multimers. TTP, wrong fucking answer. You know the deal in 2 minute from content. I'm so chill. Appreciate your time. That's it.